Hi, I'm Chantel Garcia, and I will be talking about my chosen topic, identifying personal biases and how they might interfere with professional activity, in the context of collaborating with other professions in service delivery. My first article is called Maintaining Professional Relationships in an Interdisciplinary Setting, Strategies for Navigating Non-Behavioral Treatment Recommendations for Individuals with Autism. So, in this article, the author talks about a lack in training of collaboration skills for BCBAs. BCBAs often work with other professions. We have to adhere to our ethics code at the end of the day, which means we need to maintain professional relationships, collaborate with others, and continue to recommend treatments that are evidence-based. So, Broadhead, he is the writer of this article. He provides a decision-making model to address non-behavioral treatments by identifying if the treatment is non-behavioral, assess its safety risks, and continue to research. Then we can evaluate if it conflicts with the client goals. After that, we can determine if the potential benefits outweighs its risks. Um, and does it conflict with the client goals? Um, we need to continue to research before asking questions. Take the time to understand other disciplines and only challenge treatments if it clearly outweighs its risks. The client's best interests should always be a priority. Maintaining professionalism is valuable for client outcomes, and he recommends that we use this decision-making model to address non-behavioral treatments when we are faced with a non-behavioral treatment proposal by another profession. The second article that I would like to talk about is called Collaboration Between Behavior Analysts and Occupational Therapists in Autism Service Provision, Bridging the Gap. So, in this article, they assess occupational therapists and BCBAs. They commonly work together to serve individuals with autism. There may be professional differences because each field has different approaches and philosophies. Even evidence-based practices are defined differently in these professions. The benefits of collaboration will give the client better outcomes. The biggest barrier to collaboration in this article, they found that there is limited collaboration training, um, and the biggest barrier are disagreements about sensory-based interventions. This article recommends a way to navigate that, which is emphasizing communication and sharing research between occupational therapy and ABA. We can establish clear roles and responsibilities between professionals. We can also do joint training programs with the client. The final article that I would like to talk about is called Multidisciplinary Teaming, Enhancing Collaboration Through Increased Understanding. So, in this article, the researchers analyzed psychologists, BCBAs, speech language pathologists, and occupational therapists and how they collaborate. All professions have their own unique philosophies, their own unique scopes of practice, training requirements, terminologies, and um, their different examinations. They recommend modifying jargon to where all professions involved can understand each other, engage in cultural exchange across professional disciplines, and respecting each profession's expertise. So, my key takeaway from these three articles is that we need to put our personal biases aside and have an open mind. At the end of the day, we need to act in the best interests of the client, and sometimes that means collaborating with others. We need to keep an open mind, respect other differences, and continue to learn. Um, this will be helpful for me when I become a BCBA because it'll help me to remind myself that I need to understand, then go home feeling angry that I don't feel understood. Um, there needs to be a push for understanding others and their profession. Thank you.